surgical implant. We're just going to spend a few minutes on how to be able to place the device. And this is very simple. The total artificial heart is you only replace the failing ventricles. The easier way to do the operation is actually you go about 1 centimeter below the AV groove, distal to the AV groove, and remove the ventricles. As shown here, you leave a little remnant of tissue. In the patient with amyloid, that ventricle is very, very thick, and you have to resect almost to the AV groove. And then in there, in the picture on the right side of the diagram, you saw in the atrial quick connects with running 3-or proline on an MH needle in a continuous fashion. We do not use the Teflon felt anymore. We stopped doing that about 15 years ago. And you run 1 suture line and you can correct within the interrupted stitches if there is something, or you can run 2 suture lines on each side. Next slide, please. So you go on the picture diagram on the left, you put both atrial quick connects, and then you invert them back to the normal, to the position that they have to be. You saw on the arterial conduits as shown on the right side, and it is at this time that we do the pressure testing of all 4 anastomoses to make sure there is no bleeding or potential risk for bleeding. And then we put the first Gore-Tex membrane in the posterior aspect of the heart, as shown here. Next slide, please. Then once we know there is not going to be any leak, we position the ventricles. We start with connecting the left ventricle to the mitral valve first, and then to the aortic valve, as shown here. We fill the ventricle with some saline as we connect to the aorta, and then we connect the right-sided ventricle first to the tricuspid valve with the air by filling the heart with blood, and then we connect to the pulmonary artery. Then you can put more Gore-Tex membrane, and there around you can see around the pulmonary artery, superior vena cava, inferior vena cava, there are some strips. They can be of either Gore-Tex membrane or they can be blue bands, and that's very well reported. And believe me, it makes a big difference when you go back to remove one of these devices to transplant the patient, if you have protected the TAH and the patient to simplify the operation afterwards. And there are publications about this, and I'm sure the company can make them available to everyone.